Toronto Star. I'm Reggie Mudler, and this matters. Ontario is once again in a state of emergency as we officially enter Lockdown 2.0, the sequel. Premier Doug Ford announced new lockdown measures on Tuesday, created with the hopes of curbing the spread of COVID-19, which, according to new modeling data, is growing at a rate of 3 to 7% a day, with fears that the new, more contagious variants could increase spread even faster. As for the new rules, the message remains to stay at home. But now, outdoor gatherings are limited to 5 people, who should all be wearing masks. Business hours will also be limited, but non-essential businesses can remain open for curbside pickup. There's more, but critics are already saying the measures are confusing and contradictory, and it may already be too little, too late. To take us through the new lockdown rules and some of the government's thinking behind the balance they are trying to strike, Rob Ferguson, a reporter in the Star's Queen's Park Bureau, joins us today to talk about what's different this time and what the government is trying to do. Rob, thanks so much for being with us today.
Great to be here, Raju.
The new rules dropped yesterday, and I want to get to them and the reaction. But first, let's start with what prompted them. We got to look at what Doug Ford called the fall off your chair modeling numbers first. Can you take us through them a little bit? And really, things aren't looking good, right?
Yeah, Raju, there were a lot of numbers there. We now have been doing about 3,000 to 4,000 cases a day lately, which is kind of double where we were a month ago. And the new modeling said if we go from here at current rates, we could see anywhere between 5,000 and 40,000 cases a day in the coming few weeks. That's between growth of, most days our growth is 3 to 5%. Some days it's 7%. So that's that range we could get in. And the problem with that is, even though a lot of people who test positive for COVID don't need hospital care, the higher the case numbers get, the larger number of people that do require hospital care. And that's what keeps prompting these warnings that our hospitals are filling up, and death numbers will increase to perhaps 100 a day in a few weeks. So if you think about it, that's 700 deaths a week. That's a lot of families ripped apart.
He's right about the modeling and how quickly it's moving and how scary it is, which then brings us to Lockdown, the sequel. There's already been a lot of talk about this, but we should start at a base level. What's new and different this time around, Rob?
Now you're really supposed to stay home. Before they were asking you to stay home. Now they really want you to stay home. And they've declared another state of emergency, which gives them some extra powers. So, you could technically, if you're hanging around in a park with 10 friends, you could get fined $750 to start. In reality, what the cops or the bylaw officers would probably do is just tell you to go home, or to reduce the gathering to the now maximum of 5 people instead of 10. And they want people to work from home. In the summer, got down to below 100 cases a day for about a week in August, which was very nice to have, but quickly evaporated, and we are where we are now. Traffic is pretty much back to normal. So that tells the public health officials that people are going to their offices, people are going to shop, people are going to do all this stuff. And every time you meet somebody or get too close to somebody is a chance that COVID could be transmitted. So they want to stop as much of those contacts possible. That's why we're back to work at home. And what the government wants you to keep in mind is that, going back to what we we're just talking about with hospitals, the intensive care units in the hospitals are pretty much full in half of Ontario's hospitals. So intensive care units are not just for COVID patients. They're for people who've just had emergency heart surgery or big deal cancer surgery or all manner of things and serious illnesses, of which we know there are many. So the rest of those intensive care beds could fill up in a few weeks. So it's not a good time to get COVID or to need surgery. And a lot of surgeries are being canceled. If you've got a heart condition and you needed surgery, maybe you're not going to get it for a few months. And that's going to lead to bad health comes down the road. So that's why they're telling us to stay home, because it's going to help save lives in a lot of ways. Doctors in the hospitals are warning that at some point we're going to get to the situation where they're going to have to decide who gets an ICU bed and maybe a ventilator and who doesn't, because they will run short of beds. And that'll be a situation like we saw in New York City last spring and in northern Italy last spring. And it won't be pretty, because it's pretty much battlefield medicine doing triage.
Rob, I want to get into some of the specifics and, maybe some of the criticisms, but I do want to know, I know that you talked to a lot of people. The premier said that his cabinet deliberated about this for 5 hours. Do you have any idea what the real sticking points there were and what they were really arguing about?
Yeah, that kind of lengthy cabinet meeting isn't all that unusual in COVID. I mean, usually they go for about 3 hours when they have a cabinet meeting, sometimes a bit longer. But during COVID, they do get longer because there's so many pros and cons to sort out. So I gather there was some discussion around limiting the hours of big box stores because sources told us that was on the table, but nothing changed. And there was another push in some quarters to stop the Walmarts and the Costcos from selling underwear and socks and watches and shoes, in addition to the essential stuff like groceries and pharmacy items. Somewhere in the deliberation process, either before that got to cabinet or at cabinet, that got shot down because the government is thinking they would rather have you get everything you need in one place rather than make a bunch of stops. So the argument against that was, in other provinces like Manitoba, they have required Walmarts and whatnot to rope off the non-food and the non-pharmacy aisles. To answer some of these criticisms, Ford said they'll do inspection blitzes on big box stores to make sure that they're obeying the capacity limits of only 25% capacity of customers. And the other problem is, there's so much traffic in these parking lots because there's nowhere else to go. There's the potential for a lot of human interactions, even in a parking lot. People might not realize now that they're saying you should maybe even consider wearing a mask all the time outside, particularly if you're going to be in a crowded area where you're passing people, because all it takes is one lucky droplet from someone who's got COVID hanging in the cold, damp winter air, and that could give you COVID. I actually ran into today out for a walk, my neighbor 2 doors down, who's a doctor, who reminded me of that exact same thing.
I think the thing that people are really seizing on here is some of the confusion and some things that seem contradictory. The message remains to stay at home, but you can still see 5 people outside, as long as you're wearing masks. And here's the thing, those 5 people don't need to be from my home, right? I mean, they'd prefer that to be the case. But, I have friends who live alone. If I were to hang out with them, to do mental health checks on them, basically. So, I think the question is do you think there needs to be more clarifications on this, and are more coming?
Yeah, I think they might clarify some of this. We asked them to do a bit of that yesterday because, one of the first things critics pounce on is these apparent contradictions. And I know it is confusing for people. I get so many emails and texts from people on days like yesterday when they were pumping out all these reams and reams of information. I think there's always going to be some exceptions and people need to use their common sense. But what confuses people is things like, only essential workers should be going to work. And then they say non-essential retailers can be open for curbside pickup, which means those workers can go to work and interact with their colleagues in the workplace, which is potentially another source of transmission. And we might get on the subway or the bus or drive our cars to go there and pick up that stuff. You know what I mean? So there are inherent contradictions in some of this. And unless you completely shut everything down, like they did in Italy in the first wave, and say you need a permit to leave your house that you can show the police who are wandering the street, that's the only way around it. It's tricky and it's always going to be a little muddy. I think the government could do better communication when they roll this stuff out. And the premier could say, look, I know you're going to say, this seems contradictory, but here's why we're doing it. And I don't think they do that enough. And I think they could help themselves if they did.
We'll be right back. Okay, well, you just talked about business, and I think this premier has always tried to keep business in mind. Obviously, the other thing here is there are now hourly limits. Things have to close at sort of 8 p.m. But again, you mentioned there, like sort of non-essential retail is allowed to remain open. What do you think the balance is he's trying to strike here?
They're always mindful of the economy. And you and I are fortunate to be working through all this and keep busy and have paychecks, but not everyone is so lucky. So, the government is mindful of the people who are facing hard times, and they're trying to keep as many jobs going as they possibly can. That's why we have Restaurants still open for takeout and delivery, even though indoor dining is closed. And that's why we have curbside pickup so that you can go pick up a pair of skates or pick up some new socks. That's the balance they're trying to strike. And, now in all these workplaces, like these stores that are closed, customers walking in, but open for curbside pickup, everyone's really got to wear a mask. Everyone's got to be screened. Everyone's got to be smart about this stuff, because this new UK variant that everyone's talking about of COVID-19 that's coming from Britain, that has forced Britain back into a very severe lockdown. If it surges and it's 56% more contagious, you can imagine what that's going to do to our case count. Computer modeling people are saying that normally it takes 35 to 40 days for the case numbers in Ontario to double. If the UK variant takes off, the cases could double in 10 days with triple the speed if the UK variant really takes hold. So that's frightening.
I do want to stay on the work thing just for one last question. And that one of the big criticisms is that the Ford government will not do paid sick leave. They are pointing to federal benefits. Is this an ideological line that this government just won't cross?
Yeah, I don't know if it's ideological or fiscal or what it is. Doug Ford just really didn't want to go there yesterday. What do lockdown measures mean if there aren't enough supports for people to stay home and do the right thing, like with paid sick leave or with isolation support if they have to isolate and those kinds of things? And they said, if you don't have really good building blocks in place on the supports, the measures are not really going to work as well as they could or as they should.
I think the other really big thing around here is enforcement. Ford likes to talk tough. Is there more teeth this time around? And do you expect to hear about actual, lawbreakers in Ontario now?
Yeah, I think they're trying to put in more teeth this time. Under the state of emergency, they're saying that police and bylaw enforcement officers will now have enhanced powers to go up to you if you're with 10 people in the park and say, let's bust this up. And they would have the power to issue tickets, which would start at $750. And in extreme examples could go up to 100,000 with up to a year in jail. Of course, you'd have to go to court on that. They just can't throw you in jail. So I get the feeling they're going to be more serious about it because we're getting to the point, like we talked earlier, the case numbers are getting more frightening and the consequences are getting more dire. So, I remember last spring, one man got a ticket for doing chin-ups in a park. I don't think you're going to get a ticket for doing chin-ups in a park this time because you're still allowed to go to a park. But if 7 of you are doing chin-ups in a park, then maybe you might do that. Although I am sure, like I said, they'd give warnings first.
Let's talk about the big criticisms that Ford is facing here. I want to this is hard stuff. There's good and bad, and there's pro and con. For here, right now, the most you're hearing is that there's a lot of mixed messaging, but there's also too little too late. What do you think about that?
Yeah, I talked to a doctor at St. Michael's Hospital about this yesterday, and he said the big problem all along has been we never seem to get far enough ahead of this virus, or we haven't for a long time. We haven't got far enough ahead of this virus to put it in its place. So we're always kind of playing catch up. And if you're always playing catch up, you never get ahead. But this goes back to that fine line that Premier Ford has been riding between public health and the economy. And, the economy is health because people without jobs suffer mental health consequences. They suffer stress. They suffer, maybe they're not eating as well. They can't feed their family. There's a lot of components to that kind of health. So you hear in a lot of the health community is don't wait so long to do things. I mean, we had cases starting to creep up in September after they were at those nice August lows, but below 100 cases a day. And one point before Thanksgiving that everything went 3 days later, cases exploded. And then you had to make some moves that started Thanksgiving weekend. So that's kind of how we're rolling in Ontario. And what the doctors are saying is don't wait so long. For example, the Christmas situation, they announced on the Monday before Christmas, province-wide lockdown would start on December 26th. So that gave 3 or 4 days of shopping, visiting frenzy for people before everything kind of shut down. And in the Star, we had a story on this about the traffic levels from mobile phone data were off the charts of people going around shopping and having interactions and whatnot. And we've seen what's happened to the case levels. As I mentioned, they've doubled from before Christmas.
Rob, it's funny. It's one of these things. Andrea Horvath talked about loopholes. I got to say, the minute afterward, my buddy started texting me saying, hey, we can hang out as long as there's 4 of us. Or if we have a yoga mat or do push-ups. This is terrible, but there's this mentality out there is that you tell me the rules. As long as I can find a way to just skirt by them, I can keep on doing what I'm doing. What do you think about that?
Yeah, that's one of the big problems we've had. And the Ontario Public Health people were saying 1/3 of the people in the province are just basically ignoring the COVID-19 guidelines. So they're going into other people's houses. They're going for walks and not keeping 6 feet apart or wearing masks. And, they're doing things that are really defy common sense, but people get tired of all this. I know I'm tired of all this, but I'm trying to keep myself healthy. So that's the problem they have. And then what a lot of the experts are saying is if you're sending mixed messages, like you just mentioned, then that further muddies the picture and it makes it hard to get the behavior out of people that you want. So it really is incumbent on everyone to just be smart for a few more months. They're saying they need a runway to the mass vaccinations that are going to start in April. We're supposed to get 5,000 doses a month starting in April. So it's going to be a little dicey till then. I'd hate to see anyone get COVID because they did something they shouldn't. So what they're asking people is, there's no real mystery to this. It's just, do your best and don't have the attitude that, well, I'm going to do this, but I hope everybody else follows the rules, because that seems to be the attitude in a lot of people. I want everybody else to follow the rules, but I'm just going to do this and I hope it's going to be okay.
Rob, I think that's really, really fantastic for us. Is there anything I didn't ask that you think that our listeners should know?
I think people know more about this than they think. And I guess what we're waiting for at this point is the government going to clarify any more stuff, any more of these things that we've talked about. And I think people should watch for that. And if they have questions, they can get in touch with their MPP. They can ask their doctor. There's all sorts of places to get answers to questions they don't know the answers to.
Rob, I really, really want to thank you for your time today.
My pleasure to be on with you. Thank you.
Rob Ferguson is a reporter in the Queen's Park Bureau for The Star. That's it for today. Thanks so much for joining us. This Matters is hosted and produced by me, Rajin Budler, Adrian Chung, and Saba Etisas. Produced and mixed by Sean Pattenden, and our director of programming is JP Foso. Our show theme music is by So Called, and our episode music is by Mike DeAngelis. We want to hear what stories matter to you. Please send us comments, questions, or ideas to thismatters@thestar.ca. Please consider supporting the journalism the Toronto Star newsroom does at thestar.com. And don't forget to subscribe to This Matters on Apple Podcasts, Spotify, or wherever you listen to your favorite podcasts. Let's talk soon.